kind of start with the very beginning. When
Okay.
did you first start to feel like, oh, I might be coming down with something? And did you immediately think like, oh, is this it? Tell me about the very beginning of getting sick.
So earlier in March, probably like March 7th, 8th, 9th, like in that area, I was coughing a lot. And my girlfriends would say, you need to go to the doctors, you need to get checked out. And I did go to the doctors, but coronavirus was so new at the time that nobody had the test. And I went twice to my primary care, and they just gave me Zithromax, telling me that how it's just a flu or a virus, it's just going to pass. But I was slowly dying. I didn't know that. And I did start with a fever and diarrhea, and um, I couldn't take it anymore. So my husband was at work, and I drove myself to the emergency room, and that's when they gave me the corona test, which was the Saturday before the second Saturday that I went in to the emergency room. And they took the test and called the Department of Health, and then they put me in quarantine for 14 days. But that wasn't the solution, because clearly my situation was worse than that. And on the 21st of March, my husband took me into the hospital. He literally carried me down the steps. He gave me a choice, either the ambulance or to carry me. So when we got to the hospital, they immediately put me on oxygen because my oxygen was below 80. And then they came out and they started to put me, because I was starting to have respiratory failure. So a team of doctors came in and they put me out. So I don't remember a lot of it, because I was in a coma. And they had a real good team. The team was awesome. They're phenomenal. And I got a chance to thank all the doctors when I was at Sunnyview. But I don't remember anything that happened at Ellis.
So within hours of going
Yeah.
in, you were out.
Yeah, they told my husband to expect the worst, because most people on a ventilator only, I think 15 to 20% of the people survive. So which means that out of 180 people die, and it's a high risk. And I didn't know all those facts until I started talking to the nurses and the doctors when they came to see me. And I I've started to realize, oh my God, I'm alive. I'm so grateful. I was grateful to be alive and to see my family and friends and every day. And I cried every day because the pain was so great. And
Tell me about the pain. Like where? How did it feel?
The pain was so, like, it felt like fiberglass in your body. And my hands would like have these little like spikes in them. And if you rubbed them, it just felt like you were getting pushed like like needles. And it was all over my body. I can still feel it on my face. And I would just pray to God every night that this pain be lifted from me and like broken into thousands of pieces and just swept off the earth, because it was so painful. And it's so important because I didn't know, like, I was at the gym when I realized, like, oh my God, I came home and I said to my husband, I didn't feel well, I'm going to go lay down. The fever all started, and like the temperature was 101, 102, 103. And I was just taking Tylenol, and I had sprained my ankle, and I had some amoxicillin left over, and then my doctor gave me Zithromax. So I was taking all these pills just to ease the pain. So I don't know if like that fiberglass feeling came from all of the medication, or if it like was just the symptoms of the virus. But they gave me so much, and my mom told me that my husband had to sign a paper, and I think I was one of the first people for them to try the medicine remdesivir, and yeah, remdesivir, and I think Como even mentioned it, that there was a case here, but I was told that. So it was just really a unique situation. It was my parents were terrified, my friends and family, my husband.
I mean, talk about, so you spent how long in the coma? You said like
I was in the hospital for 69 days. Today would have been 70. But, I was chomping at the bit because I made a mindset that I wanted to get out of there and start walking. And I walked out of the hospital yesterday. And so it was 69 days. So I was over at Ellis. I don't remember all that, but it was more than a month. And then I was in Sunnyview for a month and 5 days.
So when you woke up, you're at Sunny.
I was at Sunnyview when I woke up, but I was still sedated. and on the vent. I didn't know what was going on. It was Easter. My family and my friends, they FaceTime me, but I wasn't cognitive. And then they did it again, I think, at Sunnyview, and I still wasn't cognitive. That was my first week there. But only within the last 3 weeks is when I started to like do better because the therapies were working. And, you know, I mentioned to you and some other people like Carrie Beth, her last name is Adams. I want to give her credit because when she met me, she didn't think she could help me, and I couldn't eat or talk. And so she taught me how to speak again and how to talk and how to eat. And I had to take swallowing tests and x-rays of my epiglottis and my throat. It was really cool, actually, to see how the body works with swallowing. But it was the grossest food. And it was all out of a tube that you had to eat because it lights up in the radiologist. Yeah, it's so gross. And I couldn't eat chicken salad sandwiches ever again. So, or a marshmallow. So, but yeah, she worked with me every day, and my lungs is going to take about a year to heal, and she's given me some devices that we've been practice on. So I have to continue to do that therapy, and I'm going to have therapy as we go.
So what were the conditions to be able to come home?
So the conditions to be able, you had to be able to walk and not be on any devices, needles or anything, needing blood or anything like that. I was being tube fed. I have a big hole right here in my stomach and in my abdomen. That's going to heal just like my trach is healing. And but if I couldn't take the food that Carrie Beth suggested, because I only started regular foods 14 days ago. Other than that, I was on a mechanical soft diet and like a pureed, which was disgusting. And but it got me better. And yeah, it's been like 14 days for regular foods. So they didn't know if my stomach could handle all of that. And the doctor just took my tubes out on Wednesday. So it's really raw. And they just yank it out. I thought it was like, my stomach has a hole. Aren't you going to sew it? And he's like, no. I'm like, don't I have bile in my stomach? So Dr. Syed, yeah, Dr. Syed, he was phenomenal. I thanked him.
So tell me, like, you know, as you were starting to wake up and start to realize the situation, do you remember kind of what was going through your head? Do you remember days when you felt like you couldn't do it? I mean, talk to me about, you know, the first few days that you really remember.
Yeah, my first few days that I was there, I knew that I was being transferred to Sunnyview. We met my mom in the hallway because she works at Ellis, and she was able to walk me over. But then she got kicked out because it was the wrong hospital. So, but I didn't, that first week, nothing. I just was in so much pain, and I was still sedated, and they were giving me all kinds of meds. Like, I even said to the doctor, Dr. Gorla, I said, why am I getting so many pills? Like, there's, like, a human being should not have this many pills. And it was because I had so much infection that they were trying to kill it. And again, this virus is so new that they don't know, and I wasn't needing any more of the remdesivir. So, but yeah, there were so many pills. It, you know, made me constipated. It took me like 5 days. It hurt so badly. I just was in pain. It's just all part of it. But my therapist, they worked with me. They started off 30 minutes, then an hour, then 90 minutes. The 90 minutes ones were really bad, but I negotiated. I was like, if I do this, I can do this, right? And I want to go outside. And so they snuck me out like a door that, because, you know, visitors and being outside and stuff. So, I mean, they have to document it, so it's not really sneaking, but I felt naughty because we were going through the back door where the gym was. And I'd be like, we have to go to the second floor. And I said, I'll do the steps if I can go outside for 5 minutes. So I got a chance to go outside 3 times, but it wasn't until like last week. And I would negotiate.
So looking back now, and you know, I mean, you were kind of completely unaware for a month at what the situation was getting like out in the world and with all of this. So, you know, what's going through your head now when as you were learning the situation?
Sure. I was able to follow the news in the hospital, not in the very beginning, but the last 3 weeks, and and watching Cuomo come on. And the social distancing is so important. I don't think that people should start rushing back to restaurants or even life as we know it used to be, the beaches or shopping. Those things should really wait because it's such a serious virus. And it's so, like, unless you know somebody that was fighting for their life, and I was literally fighting for my life. Um, like they don't understand. They think it's a hoax. But wearing a mask, having your mask to wear your mask and having social distancing, and maybe make a list of getting things that you need at the market so you're not going all the time, and limiting your interactions with people. It's really important. Washing your hands, like all the things that they've talked about. It's like common sense, really, but we just taken those liberties for granted. And I'm just so grateful to be alive that I'm totally okay with being by myself because I'm so scared, and I have a long recovery ahead of me, and I don't want to get sick again. It's painful. It's really painful, and with the kids getting it now too, I my heart goes out to them because that pain. No one should feel that pain.
Your family, nobody else tested positive?
No, no. Well, it was so early in the game that I was removed from the house. So my family and my husband, because I was coughing so much that whole week, he actually slept on the couch because he works and he goes in very early. So, and my daughter's in college, so she lives in Colorado. So she came home while I'm here, but she came home when I was in the hospital, but because of COVID, wasn't able to see me. So my family, it's just the three of us. So they weren't around me really. And
Was that difficult?
it was really, we're inseparable, so we're always together. Um, Except with college, but yeah, my husband cried every night. So it was my family, all of them, my friends, my parents, so my in-laws were very close. So
You were
yeah,
able to FaceTime a little bit eventually.
only the last 3 weeks have I been able to do that. Um, that's when I made the greatest stride, I think. And then my friends all started a prayer group, and the power of prayer, like, yeah, I'll pray for you, right? And you just say those words. But my friends really, really prayed. And I think because of it's like a placebo added, and they all prayed so hard. And I think because of prayer.
When you see the support that you were receiving and not even knowing at the time, how does that make you feel?
Oh, it makes me want to cry. I feel like I did do some good in the world, but I'm not ready. There's another plan and purpose. So I'm ready to do that, I think. The best I can. But the purpose is greater. I'm given another chance.
Um, Talk to me about coming home yesterday. So
Well,
what was it like coming into the house for the first time? What were some of the things you wanted right away? Or
one of the most amazing feelings was when they told me I could go home. Well, they didn't tell me. They told my husband because it was family day, and it was a teach day to teach me how, like, to make sure my husband knows how I should walk with the walker, how to get in and out of the shower. We're not doing steps yet because the physical therapist will come, and but one of the things was I wanted to walk out of that hospital, not be wheeled. And so they allowed me to do that and see my friends and family. It was just, and the fresh air and the breeze, it was unlike nothing I could imagine. And then when we got home, I just remembered what Dan taught me in physical therapy of how you push the walker to the stoop and then get in. And there's 2 steps to get into the house. So when I got in, I was really surprised at how clean it was because my husband's been living by himself. And so he had the house spotless. And then my friends and parents were here and my in-laws. And I've craved pizza, so we got pizza and wings for dinner. So it was good, and I slept good, and I wasn't being woken up by needles. I've got lots of needles in my arms, bruises, so it was good. And then pills. I wasn't being woken up at 4 o'clock and 6 o'clock and 8 o'clock for pills. So
most challenging thing of your life ever? would you say?
No doubt, no doubt. Besides giving birth, but this, that was only 24 hours. But yeah, this disease is, I keep calling it a disease, but this virus, I don't wish it on anyone. It's not good. And people should not take it for granted. And social distancing and washing your hands and like covering your face.
Did you have pre-existing conditions or anything?
I was healthy. I'm a healthy person. I've always been healthy, very active. I hike, I swim. Um, I'm active in our community. I volunteer. I work. So I've always been healthy. And all my friends call me a fighter and a warrior. And I, yeah, I've never really had any medical. I've never been hospital. I've sprained my ankle, but I've never been hospitalized as long as I have.
Wow. Anything else you think is important to share?
I feel that people should really take this seriously. In the beginning, there wasn't enough research or statistics and numbers to prove, but with over 100,000 people that have died from this, it's something to not take for granted, to know how precious it is, and hug your family and hug your friends and your children. I don't think that you should take it lightly at all, and use the precautions. Don't think that you're above it, because it doesn't discriminate. It will attack you.
When it comes to contact tracing, do they have any idea? Because they were really contact tracing back then.
Uh-huh.
Where you got it, or if other people got it because just traced back to you.
Mm-hmm.
Are you aware of any of that?
No, I was in a coma, and it's been 70 days, so I haven't. I know I have to talk to the Department of Health next week. The physical therapist is and the occupational therapist. Probably the occupational therapist will help me to do some of that.
So you went into the hospital before they could do any of that?
No, that wasn't in the existence at the time.
Huh.
Contact tracing, I only think started like 3 weeks ago. So everything started like 3 weeks ago when I was cognitive of it. But I don't believe that even existed. Again, I went to my primary care twice, and they didn't have the coronavirus testing, the test kits. And then I went to the emergency room once, and that's when I tested positive.
And